The Personal and Social Performance Scale is a clinical tool assessing social functioning in rehabilitation settings. It was derived as an improvement of the SOFAs, which in turn was an improvement of the GAF with a better face validity and psychometric properties. It has been translated into Italian, which are the original language, Chinese, Korean, Ukrainian, Czech, English, French, German, Russian, Polish, Spanish, Greek, Romanian, and last one is Serbian. The developer of PSP is Pierluigi Morsini. The purpose of this assessment is to measure social functioning within 4 domains: socially useful activities, personal and social relationships, self-care, and disturbing and aggressive behavior. It has also been used in patients with a variety of psychiatric disorders, ranging from organic disorders to schizophrenia disorders. It also measures personal and social functioning among patients with psychiatric disorders in rehabilitation settings. It is a clinician-rated assessment, and the components being assessed are self-care, socially useful activities including work and study, personal and social relationship, disturbing and aggressive behavior. Your target population are mental disorder and schizophrenia. Indication and contraindication. So patients must have good insight, can understand and follow instruction, can understand the rating scale. For contraindication, lack of insight, severe cognitive impairments, cannot understand the instruction well, cannot understand the 6-point Likert scale. The administration procedure, the first one, raters will rate the patient based on his or her past month performance for each of the 4 main areas. Clinician will then interview patient and caregivers, and each of the 4 main areas is rated or scored for its degree of severity using Likert type scale. There are 2 degrees of severity, which are degree of severity A to C and degree of severity D. Raters will select a 10-point range within 100-point scale guided by the area scores assigned during assessment. Within the 10-point range, clinicians are instructed to select score based on their clinical judgment. It usually takes 45 minutes to administer. We have to take note that disturbing behavior can occur not occasional or occasional. Not occasional, it has taken place only 1 to 2 times in the period, and it won't happen again in next 6 months. But occasional, the score should be decreased by 1. Moving on to the administration demonstration. Assalamualaikum and a very good morning, Mrs. Afika. My name is Adir and I am your occupational therapist for today. You are Mrs. Latifa's younger sister, am I right?
Yes, I am.
Alright, so based on the information given, Mrs. Latifa is 40 years old, a divorcee and a mother of a daughter who is currently 11 years old. So I would like to ask you a few questions regarding on Mrs. Latifa's condition in the previous month. Does she has any problems in managing her self-care?
No, but sometimes she tends to forget few little things, such as how to dress properly.
Okay, so alright, for our next question, does she has any problems in managing the house chores or manage her financial?
I would to say yes, because for now I'm the one who managing her as well as her daughter. I'm the one who actually manage her house chores. I'm the one who actually manage her financial, as well as I have to cook for her as well as her daughter.
Alright, so may I know about her personal and social relationship during past month?
She actually only go out to visit neighbors when she have to, and mostly she likes to stay at home. She also neglect her role as a mother, so I have to take care of her daughter.
Okay, so for the last question, does she has any disturbing or any aggressive behavior?
No, but she likes to isolate herself in her house.
Is she also very unsociable person?
Yes, I would like to say that is it true.
Alright. Okay, so thank you for your contribution to our session, and I will call you next time for our next session. Alright?
Sure.
So how to score the PSP scale? Here are the guidelines for PSP total score, and here are the overall score instructions on the basis of the 4 main areas scores. So high score indicates high functioning in personal and social performance of the client. Here are the dummy scoring for this assessment. Validity and reliability. For face validity, several clinical trial studies conducted among schizophrenia patients reported significant improvements in personal and social performance measured by the PSP. There were significant but modest correlations for the content or construct validity. The relationship between PSP and the other assessment are low to moderate for the convergent validity. For discriminant validity, self-care and disturbing and aggressive behaviors had slightly lower factor loadings than personal and social relationships and socially useful activities, because these sets of questions assess different types of functioning. Internal consistency reliability for the four main areas was adequate and strong. Item total correlations was fair to moderate. As results in personal and social relationship and socially useful activities were strongly related. For the iterator reliability, the PSP was applied by two independent psychiatrists, and based on the results, it indicates a good iterator reliability. The advantages of PSP are not time-consuming, easy to administer, good reliability and validity, and measure four areas of functioning. For disadvantages, it is only for screening. Clinicians will rate based on their judgment. It is a clinical routine assessment to detect functional problem of patient. It is not detailed enough to identify the patient's problem. Is it suitable for Malaysian population? Yes, as the domains to be assessed are appropriate and it should have been better if there is Malay version as well.